Ruth Dyson.
My question is to the Minister of Health. Does he stand by all his statements regarding health services?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health, yes.
The Honourable Ruth Dyson.
Supplementary. When he answered my written question 00219, stating that Nelson Marlborough District Health Board was not cutting any services, was he aware that at the same time nurses at Nelson Hospital were publicly raising serious concerns about nursing positions remaining unfilled in order to save money, saying that patient safety at Nelson Hospital was now at risk as a result of staff shortages?
Honourable Jonathan
On behalf of the Minister of Health. I think what that member should note is that the Nelson Marlborough District Health Board has had a funding increase of $13.6 million under this government over the last year. And frankly, we inherited a massive problem from the last government, which means that, yes, there does have to be some changes to services because we have to make sure that the funding goes to the places where the public get the best possible outcomes for health spending.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister of Health, why are some DHBs looking at changes to some of their services?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health. We inherited a situation where the last government had made $155 million of unfunded health promises. So despite difficult economic times, and despite this government injecting $536 million of new money into DHBs this year, DHBs still face significant challenges. That is why some changes to services have to be made to ensure that health funding produces the best possible outcomes for New Zealanders.
The Honourable Ruth Dyson.
Answered my written question 00215, stating that Mid-Central District Health Board was not cutting any services. Was he not aware of their plan to cut 24 patient beds from the Horowhenua Health Centre?
The Honourable Jonathan Coleman.
Well, yeah, no, it is a change actually, and the fact is Mid-Central Health Board, I can give you the figure here, has had another $26 million increase in funding over the past year. But once again, DHBs are facing a difficult situation and they are having to redirect funding to where it has the greatest effect for the public.
The Honourable Jim Anderton.
Speaker, does he support, the Minister of Health, the statements of Ministers Wong and Coleman respectively that, quote, the National-led government is committed to ensuring that people with mental illness have support services to help them and, quote, early intervention is vital when people are experiencing mental health problems? And if so, how do those comments square with the imminent closure of the 198 Youth Health Centre, which provides these very services for 4,000 young Christchurch citizens at very low cost to the health system?
Well, on behalf of the Minister of Health, yes, of course he does. And I'm advised that 198 Youth Centre is contracted to CDHB and that the Minister of Health has personally been in touch with the Chair of the Canterbury DHB, who is taking an intense interest in the issue. Mr James advises us, that's the Chairman, that the DHB still has $410,000 earmarked to assist with this service and discussions are ongoing. So there may be changes, but services are being provided, as that member well knows.
The Honourable Damien O'Connor.
Thank you, Mr Speaker. When the Minister answered written parliamentary question 00220, stating that the West Coast District Health Board was not cutting any services, was he aware of any proposed cuts in the plan being developed by the Board and his office? And if not, will he now release the plan to the people of the West Coast to see what he really is going to do?
Honourable Jonathan Coleman.
Well, I can't answer your question specifically, but what I can tell you is that West Coast has had a $4.5 million increase in funding over the last year. And it's very interesting that when you talk about what this government's doing, you like to frame it as cuts. But when that government was taking $30 million out of its health budget, it was changes. So it seems that when you guys are talking about it, it's fine. When those people are, different when we are.
Could I just order, I'm on my feet, could I just remind the Minister that the Speaker was not involved in any of those actions, and that right at the end the Minister used when your guys were doing something and answered you several times in his answer, and I just remind Ministers that's not within the standing orders. Question number 9, Dr. Cam Calder.
Mr. Speaker, my question is to